considering that I like to talk about mental health topics, a good request that I got recently was to do one about how to tell if a therapist is right for you. And it's going to be very beneficial because if you take the therapy route for your mental health, it's important to know and reflect if your therapist is properly curated for you, because sometimes we can often think that our mental health is a personal failure, it means you're broken, it means whatever, you know? And oftentimes, if you're seeking treatment and you feel like it's not bettering you, it's normal to feel like it's some sort of reflection upon you, when the case is that your therapist isn't the right fit for you. So if you have been there, don't be hard on yourself. You just need to find a therapist that curates to your needs. You're not broken, you're not a failure, and you are not doing anything wrong. You are doing something right by doing this to take care of your mental health. So I'm going to go over 17 signs that your therapist is right for you. Number 1, they actually listen to you. So they don't just passively wait for you to finish talking and then they just respond to whatever it is. They actually take the time to actively listen, to understand you, to really, really see what it is from your perspective. That's one of the most important things. 2, you feel validated. So validation is the acknowledgement and acceptance of how you come to the conversation, how you are feeling, how you've acted, and the experiences that you have accumulated to this point without being dismissed, because sometimes a lot of people will listen, but then they'll judge, they'll disapprove or approve, whereas validation gives that open space for that to happen and allows it to happen and allows a person to come as they are, as their authentic selves. 3, they want what's best for you. So of course they're usually there to provide something that'll benefit you, but you need to make sure that they truly do want what's best for you. They won't force you to do anything, and they'll genuinely grab your hand and guide you along your journey. They'll guide you, but they won't be overbearing, they won't force you, they won't go against your wishes, they won't put you in a very nasty zone where it's traumatic. They'll make sure that they'll check in if it's safe for you. They'll make sure that you're doing fine through the process. They will probably try to open up different things. They'll try to open up old wounds. They'll try to do all of that. But it will all be done in a way that is conscious and very kind and compassionate. More so than just like prying it open and being like metiche. You know what I mean? 4, they're a strong communicator. So it's no doubt that strong communication is really, really needed in therapy. But strong communication and strong communicators listen more than they speak. So when they do talk, it is in a way that you're able to understand and it's accessible to you. It's not just going to be like you're getting thrown all these terms and you're like, what are they saying? They're going to actually communicate with you in your communication level. They're not going to try to like fit a puzzle piece in a different complete puzzle box. They're going to try to curate everything to translate well with one another. The vernacular is going to be there. Everything's going to be respected. And that's a really important thing in communication. 5, they check in on you. So whenever they go with a treatment plan with you, you guys plan something together, they check how your treatment, your coping skills, etc. has been, how you've been since the last session, how you're doing right now, if you have been accountable with the things that you promised or that you set for yourself as like a milestone in your own personal growth. They'll make sure that whatever you mutually agreed on is with your consent, and they'll make sure that you feel comfortable, that you want to take some steps forward, you want to reassess something, you want to take a few lateral steps in the whole path. It will always be to check in with you and to check in, especially if you're at imminent risk or danger. They'll make sure that they are checking on your safety and your well-being. 6, they take the time to educate themselves. While therapists do hold the degrees in the respective fields, and they have done lots of schooling and training to get to where they are, education isn't only limited to that space and to that time. Education is an ever-expanding thing throughout everyone's life, and they'll take the time to really educate themselves and be expansive on the myriad of topics, not only from what they already have, but they're open to educating themselves with the unique experiences, topics, developments, what's relevant right now, what you're going through, what it is that is specific to your identity. They'll ensure that they're always very open-minded and educated and refreshing their information in order to make sure that they're not just stuck on old ideas and beliefs. 7, You view them as an ally. So they work to forge a bond with you that's based on mutual trust. They're not going to be unprofessional on any level, but they're not also going to be impersonal. They'll be your ally. They'll be there with mutual trust, openness, and communication. 8, they earn your trust. So that kind of snowballs into the other one. It's the most important thing, actually a little bit more important than communication, is trust. You may be a little daunted at first, of course, because you're sharing this with a stranger. You're getting to know who this person is. You're going in with a healthy skepticism. But over the sessions, you should be able to feel safe and supported, like you can say anything to them without being judged or without fear or without feeling belittled and dismissed. 9, you notice a change in yourself. Now, while results won't be right away, and growth is not linear at all, it takes time, you will notice incremental changes within you. You'll notice your thought patterns changing. You'll notice your habits being a little bit challenged. And it can be in any small or big step, but you will notice some sort of incremental change within you. 10, they challenge you, but respectfully. So they will challenge you not in a sense where they're like, hey, do this, do that. They'll throw you into the ocean to swim. No. Like, they will question your irrational thinking patterns. So if you are prone to any cognitive distortions, they will question those thoughts. They'll question the catastrophizing that you cause. They'll question your anxiety. They'll question your depression, but not in a way that makes you feel worse about yourself. It'll be in a way to like help you take back control over your thoughts, over your mind, over your emotions, more so than feeling at the mercy at it all the time, and giving you a space and the state of being empowered in your own journey rather than helpless to your mental health. You'll actually feel like, okay, I can take the wheel when it comes to my mental health and well-being. Will it be easy? No, but you do have that power, and they will ensure to emphasize that because you are more powerful than you think you are. 11, they offer a range of solutions, so they know that you're not going to be a one-size-fits-all kind of person. They'll try different things with you that curate to your needs. They will brainstorm with you. They will see what it is that's specifically there for your needs. They won't suddenly give you cognitive behavioral therapy when you're going through a phobia. You know what I mean? They'll go on the right route to support what it is you need, and they'll be prepared with different variations that allow you to have options. 12, they're open to alternatives as well. They'll ensure that the solutions they have do not interfere with your ability to function in day-to-day life. They'll take a different approach if they need it. So if you have trauma that you've experienced in your life, they're not going to cause you to open that wound and then just walk out of the session with an open wound that's going to affect you in your day-to-day life, that's going to make you traumatized again, that's going to make you feel inhabilitated or have a lot of emotional distress stirred up inside of you. They'll ensure that it supports you and that you walk away able to face the rest of the day rather than feeling like, oh my goodness, when is the next session going to come up, because you need to address the next step rather than feel flooded by it. 13, they don't rush your treatment. So they will show adaptability and everything with your treatment plan and flexibility, because you'll agree on a treatment plan, but they will also realize that, okay, wait, we need to go into this route a little bit because this person has said that this is important for them to address. They won't just like, okay, yeah, get it, do the steps, do the criteria. No, they'll be present through it all, and they'll recognize that things are so unique, and they'll be flexible and adaptable to all of that. 14, they're mindful of all aspects of your identity. So no matter what it is that is a part of your identity, you can have so many identities that relate to certain communities. You can have so many identities that are also intersectional. So not only will it be, okay, you're part of this community, no, but there's all these specific facets to you. If they share similar backgrounds to you, that is fantastic. But if they don't, they'll also have that willpower, that education to understand where you're coming from based on your identity, rather than approaching it only from their bias, only from their viewpoint, only from their limited range of experience. They'll genuinely want to see what it's like to be in your eyes. They'll empathize more than sympathize when it comes to that. They'll be able to be educated also on the different issues that your identity and identities face in day-to-day life. 15, they take the back seat. So they're not going to use your sessions to address their own concerns. They won't share or overshare technically. They'll share sparingly because that's how you relate to one another. That's completely normal. But they will do so without taking the focus away from what the goal is in that session. Or they won't do it in a way that'll be unhelpful or unsupportive to you. 16, they give you the tools to do the work. So you obviously go to an expert to be able to understand yourself, to be able to walk away with coping mechanisms, to heal, to do whatever it is that your goal is in therapy. But they give you tools to do the work too. So it won't be only dependent on the session itself, and you have to wait like every week or more to actually make progress. They'll brainstorm things like coping skills. Once they identify the goals, they'll give you the little things and practices and challenges and homework to be able to take it outside of the session, to take it off of the couch, to be able to be like, okay, we talked about this. They told me whenever this happens, tell myself these affirmations. Challenge my thoughts this way. I need to write a list of this. I need to write what I'm grateful for. I need to try these habits to see how it makes me feel, if it benefits my mental health, etc., etc., etc. And last but not least, 17. You can see the value in your work together. So while the reasons for going to therapy may be heavy on you at the moment, I don't know exactly what it is that you're going through. And there's no situation big or small. It's not comparative suffering at all. Whatever your reason may be, it should fuel hope in you with the work you're collaborating with. It should feel a little bit of hope, even when you feel hopeless, because you feel supported, or at least you feel like someone listened to you. That's how you should walk away, instead of feeling alienated or othered or anything like that. So I hope that this is helpful. I did a lot of research. I wrote it in my notes to make sure that I can refer to them and just give you some sort of a guide if you're searching for a therapist right for you, and if you want to just maybe check off the list for the person that you currently are getting therapy from. So I hope this has been helpful. Have a great mental health day. Thank you.